Welcome to This Explainer. Today, we're jumping right in to gently unpack the clinical definition of complex PTSD, and we'll walk through 5 phased CBT techniques. If you're navigating this yourself, you already know how chaotic complex trauma can feel. It's like your nervous system is operating without an instruction manual, right? Well, this space is designed to be completely safe, highly predictable, and entirely focused on empowering you. By breaking recovery down into specific, manageable phases, we remove the guesswork. We're creating a structured path forward. So let's take a comfortable breath, anchor ourselves, and just get right into it. To keep things entirely predictable, here is exactly what we're looking at today. 1. What is CPTSD? 2. Basic and easy grounding. 3. Medium-level thought records. 4. Hard and expert processing. And finally, 5. Getting professional support. Knowing what's coming next is super important for feeling secure, so we're going to follow this map step by step. Let's kick things off with Section 1. What is complex PTSD? To really understand this, let's first look at how the ICD-11, which is the international classification system used by the NHS, officially recognizes CPTSD. Unlike standard PTSD, which usually stems from a single isolated event, complex PTSD develops from prolonged or repeated trauma. And seeing this officially recognized is just profoundly validating for millions of people. It acknowledges that when trauma is inescapable over months or years, it literally shapes how the brain and nervous system develop. Now think of standard PTSD and complex PTSD like a giant iceberg. Visible above the waterline are those core symptoms we all associate with trauma. Re-experiencing flashbacks, avoiding certain people or places, and that exhausting hypervigilance where your nervous system is just stuck on high alert. But submerged below the surface, that's where we find the deeply felt identity-level disturbances that truly define complex PTSD. These include profound emotion regulation difficulties, like intense anger or just complete dissociative numbness. It also includes a persistent negative view of yourself, maybe carrying some really heavy toxic shame, and a deep struggle to sustain trust in relationships. Acknowledging these submerged layers really validates just how much neurological heavy lifting is going on beneath the surface for you every single day. Moving right along to Section 2, Basic and Easy Grounding. Now that we have that validating foundation, let's look at some immediate, completely safe grounding exercises you can use right now. When hypervigilance or a flashback hits, your brain's alarm center, the amygdala, basically takes over. It floods your body with adrenaline because it genuinely believes the past trauma is happening right this second. But simply naming what is happening out loud bridges this crucial gap between then and now. You can literally just say, out loud or even in your head, this is a flashback. It's a memory, not what's happening now. That single, simple sentence is incredibly powerful. Why? Because it engages your prefrontal cortex, the logical thinking part of your brain. By bringing that part back online, you actively start to interrupt and quiet down that automatic alarm response. Next up is a technique you might already be familiar with, the 5-4-3-2-1 method. This structured sensory countdown acts like a neurological circuit breaker when your nervous system gets overwhelmed. When you feel your mind drifting back to the trauma, you just count down your senses. Find 5 things you can see around the room, 4 things you can hear, 3 things you can physically reach out and touch, 2 things you can smell, and 1 thing you can taste. This works so beautifully because it forces your brain to process real-time, undeniable sensory data. By demanding that your brain focus on your physical environment right now, you literally pull blood flow and energy back to the rational parts of your brain. You are physically anchoring yourself in safety. All right, stepping up our ladder, Section 3, medium-tier tools, specifically thought records. Once you're feeling a bit more grounded, we can use cognitive behavioral tools to restructure how we process distress. The classic CBT triangle shows us that our thoughts, feelings, and behaviors are all deeply intertwined, so shifting just one of those can change the whole dynamic. Imagine tracking a trigger. Let's say you walk into a crowded room. Instantly, an automatic thought flares up, I'm in danger. The resulting emotion, pure intense panic. But by writing this down in a structured thought record, you carve out a little bit of space to create an alternative thought based on actual evidence. You might write, I feel uncomfortable, but I can clearly see the exit, and physically, I am safe. Now, to be clear, this is not about toxic positivity or just ignoring your feelings. No way. It's about evidence-based reality testing. By gently testing your automatic trauma responses against the concrete reality of the present moment, you're slowly teaching your nervous system that it can actually afford to stand down. That brings us to Section 4, hard and expert processing. As we transition into these more advanced stages of recovery, It is absolutely vital to pause and remember that these next steps are designed to be done exclusively with a trained therapist. This completely removes any pressure on you to tackle them alone. So let's talk about imaginal work. This is a structured, gradual retelling of a traumatic memory in a highly detailed yet profoundly safe setting with a clinical professional. The whole goal here is memory reconsolidation. You see, during trauma, memories are stored improperly. They get shoved into the happening right now folder of your brain. Imaginal work helps your brain finally process that memory so it gets correctly filed away into the happening in the past folder. Because you're confronting the memory directly, this work can temporarily spike your distress before it actually reduces it. And that is exactly why it sits in the expert tier and why a specialist acts as your safety net. You are never, ever expected to do this part by yourself. And all of this builds into a complete recovery framework according to NICE guidelines. Notice how healing from complex PTSD is not some straight, unforgiving line, right? It's a dynamic cycle. Step one is always to stabilize. Think of it like a tree putting down deep roots. You have to build those emotion regulation and grounding skills first to ensure you're securely anchored. Clinically speaking, it's actually considered unsafe to jump straight into trauma processing without those roots. Only when you're stable do you move to step two, which is processing the trauma with your therapist. Step three is integration, using tools like those thought records we mentioned to rebuild your self-belief and your relationships, those submerged iceberg layers. And finally, step four is maintain, where you loop back to stabilize whenever you need to. You are always allowed to revisit the basics. It's a continuous, supportive cycle of healing. Let's move to our final section, Section 5, Getting Professional Support. Knowing these distinct phases is immensely helpful for understanding your own day-to-day journey, but securing professional guidance is your ultimate anchor for CPTSD recovery. If things ever feel unmanageable, or if those flashbacks and panic attacks start overwhelming you, remember that you are entirely in control of asking for support. Reaching out for professional help is a profound act of self-awareness and strength. It's absolutely not a sign of weakness. You can easily reach out to your GP to find a trained trauma therapist, and in many areas, NHS talking therapies even let you refer yourself directly without waiting for a doctor. If you're ever in immediate crisis, NHS 111 and the Samaritans on 116123 are completely free, confidential, and there for you 24/7. Your anchor is always available, and you never have to carry the heavy stuff alone. As we wrap up this explainer, I want to leave you with this thought. Healing from complex trauma isn't a race. It's a phased journey, and you don't have to walk the hardest steps alone. CPTSD is treated in these distinct phases because your brain quite literally needs time to build a foundation of safety. Healing is a journey that honors your unique pace. So as you move forward today, I'll leave you with this final empowering question. Looking back at the safe, manageable tools we've explored, what small, basic grounding step can you practice today to remind your nervous system that you are safe, right here and right now?